I've been in practice for 36 years. I wanted to be a doctor because of the doctor that we all went to when we were kids. My pediatrician was the single most respected human in the town I grew up with. Dr. Roy was known by everybody. Everybody respected him. Everybody looked to Dr. Roy for the answers, not just about healthcare, but Dr. Roy was the source. I wanted to be Dr. Roy. When I went into practice, I finished my training in 1990, went into private practice, almost everybody was in private practice. Easily 3/4 of the ophthalmologists in the United States were in what we would recognize as the private practice of medicine, the kind of doctors that you went to see when you were a kid, the kind of doctors that you were still seeing in the 1990s. There have been some really, really devastating consequences for healthcare in the United States from policies that were proposed that really were quite well-meaning. The Affordable Care Act, the Inflation Reduction Act, things that really on the surface looked like they were going to be really beneficial to all of us as patients. Again, I'm an old guy. I'm a patient now. I have 2 new hips. Eventually, I'm going to have 2 new lenses in my eyes. I'm invested on the patient side. I want to have the experience that I had when I was a kid. I'm in a classic private practice. We're a dying breed. Less than 30% of ophthalmologists in the United States are in what we would consider private practice. I think that private practice is worth saving. So here's my plea. Here's my request. Here's my wish and here's my hope. It doesn't matter what kind of practice you're in if you're not in a private practice. You can be in private practice. You can hang a shingle. You can hang a shingle and go in solo practice. It can be done. You can join a group. You can go find somebody like me who's in the last 3 innings of the game, and they're looking for a relief pitcher to come in. You can do it. There are some things that would be really super helpful. I'm speaking to you from Washington, D.C., and it would be great if some of those things could be fixed at the legislative level. But I got to tell you, it's much more likely that it'll happen if you go into private practice. So whether you're coming out of your fellowship, congrats, welcome aboard. Coming out of your residency program, you're not going to do a fellowship, congrats, welcome aboard. Maybe the practice setting that you're in is a more corporate practice, or maybe you're in an academic practice and there are things that you think that you can do better, that you can achieve more for your patient in a private setting. Come on out. Hop on board. Fasten your seatbelts, man, because it's a wild ride, but you can do it. Everybody in the country will be better for it, not just in ophthalmology. Private practice is special. It was always special. It should never have gotten to the point where somebody like me should be trying to convince somebody like you to join me. But that's me. I'm here. I'm making the ask. This is my big issue, Tom, and thanks for letting me share it.